I'm Dr. Marcia Sonity,
And I'm Dr. Caleb Moore.
and this is
The Free Smiles Podcast.
So, we are talking about teeth whitening.
Teeth whitening. So, what I would love to do today is just get down to the nitty gritty and really dive into what is healthy for the teeth and what's not healthy, right? And I think that, we can laugh about this, but there are some crazy things posted online about teeth whitening and what can get you a really fast white result versus what is actually healthy for the tooth.
Yeah.
So
and what's photo editing online and what actually is doing something, because you can just change the scale on the camera.
Oh, absolutely. And also I can spot Photoshop a mile away. So if any of you ever need me to review if this is actually good tooth whitening or if it's Photoshop, let me know.
Yep. Yes, exactly. Coming from a professional photographer. You know what these teeth whitenings kind of remind me of is when I was growing up, there was this thing where in I think it was the 90s or early 2000s, it was you put lemon juice on your hair, then you stand outside, you can get highlights.
Right.
And we definitely tried this, and I mean maybe that works for some people, but who's putting
Don't you end up with orange hair?
No, it definitely does something funny to you. It's not right. So anyways, that's before, that's when the internet began. So here we are today with all
maybe this summer I'll try it, right?
Right. I mean, maybe I'd save more money on my hair appointments.
Exactly.
But so let's go with over-the-counter products. So teeth whitening in toothpaste, I think is the biggest question I get from patients is hey, is this tooth whitening stuff okay? Should I use this Crest, whatever they, optic white, or I think that's what
3D white,
3D
optic white.
Yeah.
There's an everyday white.
White.
Right.
So the one thing about whitening toothpaste that we know is that they are extremely abrasive. So
absolutely.
That is why they can call them whitening, is because they have these higher abrasive particles that are said to remove more surface stains. So for people who want a actual chemical process to whiten their teeth, really any kind of whitening toothpaste is not going to truly whiten your teeth. It's just going to be more abrasive, remove more surface stain,
but also structure.
And structure. Actually, it does. Right. You're right. We should actually talk about that too, because we have patients. I have patients all the time. They're oh, my teeth have been really sensitive lately. I don't know what's happening. And I'm oh, did you change anything? Any products you're using? They're oh yeah, I'm using this new whitening toothpaste. I was yep. And then their gum recession gets worse, and they have more sensitivity around their gum line. They have cold sensitivity now, and so that's a huge part of it.
Right.
Yeah.
So I think when I'm explaining, when patients come to me and they're does this whitening toothpaste work? Or if they're having sensitivity from using a whitening toothpaste, I explain it to them as you have these little channels, so you have these little channels underneath of your enamel. The enamel is the armor, and it protects those channels. But once that whitening toothpaste is on the tooth, it opens it all up. So now you have this direct line of communication to the nerve of your tooth, and that's why you're getting the sensitivity. So you shouldn't be using the whitening toothpaste, because if you're using that every day, it's going to be really abrasive and take away that outer shell. And I know that for the listeners who are dentists, this is common knowledge to us. It's duh, we know that. But the general population, they don't know that. They don't understand that. They want something that's going to whiten their teeth, but they don't understand the side effects of that and what this over-the-counter product is doing to their enamel.
Right. Well, also it's it opens up questions. So I think a lot of dentists, especially younger, newer dentists, don't think to be your patient's coming in with increased sensitivity to their hygiene appointment. That should be part of your questions that you're asking them. You should be asking them, did you change any products? Are you using a whitening toothpaste? Blah, blah, blah. And I would say 9 times out of 10, that's literally the answer. Yes.
Right.
Yes. Oh yeah, I started using this. I just wanted my teeth to be a little whiter. And then we, opens the conversation of, okay, well, what are your goals with whitening? What do you want out of your teeth as far as whitening goes? And then you can start going down what kind of office, professional whitening is. And then if that person's a good candidate for whitening too, and what kind of products you would use with them.
Yeah, because there's so many ways that you can whiten your teeth. You have the over-the-counter toothpaste. They have a little gel. They have the whitening strips. And then when we talk about professional options, you have take-home kits that you can give them. And then you have the in-office treatment, which is going to give you that wow factor. But what I always tell patients, something that you said was, you can only go up so many shades. You're realistically only going to go up 1 or 2 shades. So what are your goals? What type of whitening are you looking for? Is that even achievable with any of these products? And I want to dive into all of them and talk through, what options are good for certain people.
Yep.
But at the end of the day, if you're looking to get that bright Hollywood white, it may not even be from whitening.
Yep.
So yeah, I think
most
that's
of the time it's not.
Most of the time it's not from whitening.
And I think, going through why. Like, why is it that whitening isn't going to achieve like that Hollywood, like, I want Miley Cyrus teeth, those are crowns and veneers. And that's how they look, like opal white, like super, like, you can't see, there's no translucency in that. Like normal natural teeth have like a translucency. They have a little bit of like a darker edge to them. Not because the tooth is darker, it's because that tooth has translucency. Your enamel has a normal translucency around the edges of it. And we can create that look with veneers by adding that shading into those areas. But if you want like flat white teeth, that is typically not a whitening process.
Yeah.
And
I think too, and patients, I think they do understand, they understand that, I do need to do veneers if I want to go this white, right? Or, it's easy to explain that to them, but, from my experience and, different patient populations, they want to get whitening like the cheapest they can and make it as easy as possible.
Which there are really good products that are cheap and effective.
I agree. Yeah. I do agree. I think that some of the things that people have to be aware of and to be a little cautious about is what is it doing to your tooth and also the gum tissue, right? If you're going to getting over the counter Crest 3D white strips, they do work well. Like I've used them. Like I'm not going to sit here and say I don't use that product. I think it's a good product. However, I have the knowledge to understand that I can't put that strip on my gums. You have to understand that these products are made and they are safe and they can work. But it can cause increased sensitivity. So
increased sensitivity, irritation of the gum tissue, especially if you're someone who tends to have like, gingivitis or any kind of gum disease issues, any kind of ongoing like periodontal treatments or gum therapy. Like whitening should be the last thing, and it should be in a very controlled environment.
Yeah.
So kind of ending the topic of take home like over the counter like 3D white strips or something like that. I think that's a good like intro to whitening for some people.
Yeah.
But then there's the caveat of you have to do it for like the 10 days or 2 weeks.
Yeah, it's like 7 to 10 days.
Then you have to do that pretty consistently. Like if it starts being sensitive, you could take a break and then go to the next one. But knowing that whenever you're whitening for the next like 24 hours, if you're drinking coffee, if you're drinking red wine, if you're having those darkening like tooth, things that can stain your teeth, you can actually absorb more of that stain during that time. Yeah. So in order to achieve a whitening, you really need to cut those things out of your diet for that 2 weeks plus a little extra so you actually get the whitening that you want.
Yeah, and I think because when you're whitening with these whitening strips or take-home kits, and it's an extended period of time, you're drying the tooth out.
Yep.
So, you're getting this hydrogen peroxide into the tooth and it's dried out. So it's wanting to absorb any water or like any of the coffee, or if you have red wine or blueberries or turmeric. Like,
oh my gosh, turmeric.
Yes.
Remember that one time that I had turmeric with my orthodontic button and it was bright yellow.
Okay, so Marsha was undergoing clear aligners and she had a button. And you like live and breathe by like turmeric, right?
I do turmeric in my bone broths. I do turmeric in like my like organ meat stews and things like that. And I didn't even think about that when I literally was going through clear aligners.
And you have a beautiful smile, you really do. But
and
I saw you one
day.
Teeth. I know, and I saw you one day, and I was like, imagine my surprise when I see this bright yellow tooth. I was like, what is going on
and
here?
It was literally like the day before too. He's like, what is wrong with your tooth? And I was looking in the mirror, I think for like 2 weeks, I don't know. I got dressed in the dark, I guess.
Right. Obviously.
And also we were living in that studio and the lighting in that studio was like horrific. You couldn't see anything. So anyways, obviously I'm in public and I'm like smiling with this like bright yellow tooth, and it was my canine. Like it wasn't like.
Oh, I know. I remember it. It still haunts me to this day.
Yeah, no, it haunts me. So now warn my patients if we're going through clear aligners, do not have turmeric.
Yes, and also if you are whitening, do not have red wine, do not have blueberries, do not have turmeric. Like, make sure that if you are undergoing these take-home kits that you're being aware of that, you know, clear liquids and just things that are neutral, so that way your tooth is not absorbing that color.
Yep. So what the next product I think is the most common would be, well, we don't even want to talk about like the things they see, like the mall kiosks, because I think those aren't even like a thing anymore. But do you remember like when you go to the mall, this is when malls were relevant. This is really aging my life. So you go to the mall and there's like these kiosks that they'd be like, oh, whiten your teeth, and it was like $50. But legally they couldn't whiten your teeth because they weren't like dentists or like, you know, registered for any kind of like dental anything. So to get away with it, they would actually just like hand you the product and make you put it on. So that's that way technically they're just like, oh, it's like almost like selling you that like head-on stuff that used to be in the infomercials.
Yeah.
Like they can't say what it did, so all they said was head-on, apply directly on the forehead.
Right.
So whitening, apply directly on your own teeth.
Right.
And then they can get away with it. So that's how that works, which I don't think is even relevant anymore. But
no, it's hilarious. I remember when I used to go to the mall. I mean, I did, and I don't remember the tooth whitening, but I remember like the bath fitters, like they had like the bath fitters and the whatever. And this is so irrelevant, but like, I don't know. It's crazy. So I really think that, you know, anything that even people like there are what are they, like the people who do like facials or like an esthetician, you know, they're offering like tooth whitening now. Like you have to be careful about who you're going to and what certifications they have, because you can really damage your tooth. Yeah.
And like what's that gonna like do if you're doing like, you know, like one treatment, it's probably not the end of the world.
It's not the end of the world.
But there's a reason why, like when we're doing a professional whitening, we're burying off your gums, we're burying off any recession.
Let's talk about that. Talk about the process. So you come in for, you know, you're not looking for the take-home kits, you're not looking for the whitening strips or the mall kiosk where they hand you the product. So people are coming to you for professional whitening. What's the process like?
So normally the question is, hey, how can I get my teeth whiter? And then I'm presenting them all these options. Like I really do go through all the options with people so they truly can make the best decision for themselves. So I would say most people are like, I just want to get it done. They don't want to spend 2 weeks whitening their teeth. They're not going to do that. They don't want to worry about the downtime of like, okay, I now need to drink coffee and do all these things. So then I talk about our in-office whitening. Most people that offer in-office whitening, they're going to offer you, and I do this, is we have a 1.5-hour session. You have up to 4 rounds of the highest strength gel, so it's not like over the counter. That's why we're allowed to use it professionally, because it's a really high strength gel. And we barrier off everything. We use little like lip retractors so your lips aren't sitting on that gel. Like we're covering all the tissues. You're watching a Netflix movie or whatever. And then afterwards we're making you custom trays. So when you're done with the process, you're going home with trays that are fit for your teeth, that are scalloped, so they're not like growing onto your gum tissue, and you're not whitening at home with the same strength of that gel that we use. It's a little bit of a lower strength, maybe a different composition of that. And then you're able to touch up, you know, because whitening is it's not like you're going to stay white forever. Like in 2 weeks, you're going to go back to drinking things that are originally going to like bring you into whitening again. So, you know, 6 months to a year, you're going to want to, you know, whiten for a couple nights just to like, you know, touch it up a little bit. But normally we're using like a hydrogen peroxide. That's usually the strongest, unless you have sensitivity. And then we would use something like carbamide peroxide, which is a little bit better for sensitive teeth.
I think too, you know, what's important about what you said was that we're isolating the teeth. We are putting a barrier on the gums, and you know, so we're isolating the teeth, putting a barrier on the gums. It is a controlled environment for the high strength material that we're using. And like I said, like it can pool in your saliva. You don't want to be swallowing that, like I said earlier. So it's making sure that if you're having these higher strength products, that it's from a professional and that it's in a controlled environment. So I really think that, like you said, for people who don't want to spend 2 weeks trying to weigh in, you can do it in an 1.5 hours. You can come into the office and you can leave with teeth that are 2 to 3 shades whiter. It really is a wow factor. And it's safe though. And I really want people to understand that you're paying for your teeth to be whitened safely. And also the take-home kit that comes with it. so you can upkeep and manage it.
Exactly.
And also, you know, like in our office, we have like a vitamin E fluoride mix that we put on the tooth after.
Right. And that's something, that's a good point. So I forget about that. So we have 2 products. One of them is like a vitamin E type of like gel that we can put, like you can have or put on. There's also a product, calendula. I think it sounds cool.
It does sound cool.
So that's a nice, just if there's like gum, you know, tissue irritation or something like that. Sometimes we'll just use that after, you know, certain procedures that we do. And it really helps to like heal the gums, soothe that gums. You know, you can use that if you have like a, you know, chemical burn, if you're whitening at home and you get something and you don't notice that it's overflowing onto your tissues, which you should notice that right away and wipe that off. But those are, you know, great options for, you know, if something, you know, happens in that situation.
Yeah, and so and along with that too, there's different types of whitening that you can do. There's like light activated and non-light activated, right? And the ones that are going to work a little bit faster are activated by the light. Mm-hmm. So we use the blue light, and also with the company that I'm using in office, you get the take-home light, and it also has red light therapy, mm-hmm. which is supposed to help heal the gums. Yeah. So it's really beneficial for the gum tissue and to help the healing process. And so I think that, you know, if you're gonna invest into an office, you should know what you're gonna get out of that and what the take home is gonna look like for you.
Yeah, I think just having transparency with your patients, like the biggest part of it, like when someone's like, oh, my teeth whiter, but then I'm like, okay, well, what do you see as far as like your teeth being? If they have like a very like a yellow type of stain, I know they're gonna whiten very well.
I agree.
Like the coffee stain, that kind of stuff, like that's gonna whiten and brighten beautifully. If they have more like gray blue tones into their teeth or more translucency, I'm very honest with them saying, yeah, we can brighten these, but it's not going to give you the in your mind what you think whitening is going to give you. Yeah. That again is going to be a veneer or something that's porcelain, and then that gets, you know, the next thing would be, okay, if you really want your teeth to be white for a long time, really veneers that's the tried and true way to make sure that color stays that color. That's the one thing that's not going to stain.
Yeah, and our enamel is so, you know, absorbent of any of these stains, and so is bonding. You know, if bonding is polished really well, it can be like enamel, and
it can be very resistant to stain.
It can be very resistant. So you do have options, and you can, but even layering, you know, with bonding, you're still gonna have that natural tooth under there. Yeah. So I think that there is a place for porcelain, and I think that if you really want that maximum whitening, that you should consider it, because, you know, how realistic is it to say that your translucent tooth is going to become this bright milky white tooth? It's not going to happen.
Yeah, no, it's just not realistic.
It's not realistic. And so like you said, just having transparency with your patients and going through all of these options, because, you know, if I were to walk into, I don't know, like a doctor and talk about different types of like knee surgeries, or, you know, I'm not going to know anything about it, and I'm not going to know what's the best. Yep. So we have to be honest and lay it all out for them, so that way they know what they're investing their time into.
Yeah, exactly. Because at the end of the day, we want our patients to be happy. We want to see good results, and we want the things to last how we know that they're going to last. So certain patients aren't good candidates for whitening. Like I would say, those patients that just tend to have sensitivity when you look at them, like they walk into your office and they're like, no matter what you do, my teeth are going to be sensitive. It's not that they can't have whitening. It's just, I'm very specific with saying, even with the carbamide peroxide, like my one a treatment coordinator that I used to work with, like she had super sensitive teeth. We tried the carbamide peroxide with her and she was still very sensitive. Yeah. But, you know, it's usually like 24 hours and then it's done with. It's not like it's an ongoing thing. But being very transparent that even if we're going to try this product that's going to be less prone to sensitivity, it doesn't mean like null and void, nothing will happen. You know, there's still like the opportunity that sensitivity is still going to happen for that 24 hours.
It can happen, yeah. And I think I want to dive a little bit more into the difference between the two, because hydrogen peroxide is usually a higher concentration. Yep. And so it's for those like in-office treatments where you're going to see results really fast. So it dries the tooth out more, it's going to be a lot whiter, brighter, it happens faster. Along with that, people who are likely to have sensitivity, they're going to have sensitivity with this product. And like you said, especially for a day or two after, and we can set them up for having decreased sensitivity, but it's going to happen. Now with the carbamide peroxide, there's still that chance. However, it works a little bit differently. So it's a lower percentage. It's a different chemical makeup, and it actually is. It works over time. So if you're going to be using a carbamide peroxide, it's usually like an overnight treatment. So you're going to whiten your teeth overnight, or more of like an hour or two versus like a 20 to 30 minutes, and you have to do it more often because it's not as high strength. But there's research out there that states that it will, have less likely to have the sensitivity. But like you said, even along with that, all of this is still, putting your tooth in a decreased state, right, of protectiveness, right, because you're opening it up and you're trying to dry it out to make it whiter.
Yep. Yeah, exactly. Yeah, and I think that's just like comes, the take-home point is like, if you're gonna be whitening your teeth, it's not, it is a medical procedure.
Yeah.
You know what I mean?
Right.
It is putting something on your body, in your body, and knowing what that product is very important. Even if it is like a one-off thing that you try or whatever it may be, or if you're thinking about investing into veneers or something like that, like you should really do a lot of research and time, really know what that is, know what the downtime is, know what the adjustments are, because all these things they're medical procedures. Like we want to do them in a safe environment, we want to do them properly and set them up for success.
Yeah, I agree.
Thank you so much for listening. If you enjoyed this episode, please share it with a friend. Don't forget to leave us a comment, rate us, and subscribe so you never miss an episode. We appreciate your support and look forward to bringing you more great content.